Millions of people are dealing with someone in their family that has kidney disease. Now, if you have end-stage renal disease, you're at the very end, I think there's 5 stages, and you need a transplant. You're on dialysis and you need a transplant. Medicare has a special program for you. It's called ESRD Medicare. So you don't have to apply for Social Security disability, although you had to have worked enough to qualify for Social Security. So you had to have worked at least 10 years and gotten your 40 quarters or qualifying off your spouse. But you're not going to have to go through the process of Social Security disability to get what we call ESRD Medicare, and it's the same if you have Lou Gehrig's disease, ALS. To get ESRD Medicare or ALS Medicare, you don't have to apply for Social Security disability. Most people that get on Social Security disability have to do, it takes a long time. Even if you have a compassionate allowance and it's fast-tracked, it can still be a process. This is pretty simple. If you get a diagnosis that you have end-stage renal disease, you can go to the Social Security website, ssa.gov, and you can apply. You will then fax them a copy of your doctor's diagnosis, and you should be able to get Medicare, quote-unquote, government immediately. Now, if I'm working when I get end-stage renal disease and I'm on my employer's health plan, my employer has 20 or more employees, my employer can't kick me off the health plan. I'm too sick to work, I'm on permanent medical leave, FMLA. They can't kick me off, but my health plan still has to pay. My health plan is still primary until I've been on Medicare for 30 months. Yikes. So I'm a very expensive burden to my company. But after 30 months, you can bet that my company is going to kick me off their health plan. I can continue to work there unless I did something wrong that they could legally fire me. But they can legally discriminate. They can legally terminate my health coverage after 30 months. Now, if I'm on ESRD Medicare, ESRD or ALS Medicare, it is still Medicare. But it's different because I'm under 65. In most states, the vast majority of states, when you get Medicare and you're under 65, if you want to get supplemental coverage to fill the gaps in government Medicare, you can't. And that's based on your individual state law. For example, if you're in Indiana and you get ESRD Medicare at 50, you can get a Medicare Advantage plan, but you cannot get a Medicare supplement plan. Now, there's a lot of advantages to being on a supplement plan, and that's really where I would love for you to be, but it's not available because you're not yet 65. Now, when you do turn 65, you'll be able to get it regardless of your health. But there's a new law in Texas that just starts September 1st of 2025 that says that if you have end-stage renal disease or ALS, all the insurance companies that are selling Medicare supplements in that state have to sell you a Medicare supplement plan. So that's very unusual. Like I said, there's a couple other states, New York, there's a couple other states, Florida. This is new for Texas, Texas being one of the biggest states, it's unusual. So if you have end-stage renal disease in Texas and you're 50, you could get a Medicare supplement in Texas. Now, can you afford it? That's where they get you. The state government is telling the insurance companies, you have to sell it to these people. The insurance company is saying, these people are really sick. We don't want to sell it to these people. They're going to be very expensive. So the government said they have to sell a certain plan, Plan D, at the same rate as everybody else that's turning 65. So that's really nice. Only problem is, nobody sells a Plan D. So if they did have a Plan D available, and you know, the A, B, C, D, E, F, all the different Medicare supplement plans, not every company files every plan. They all file a G, but they don't file a D. They could, most of them don't. They don't file, some of them don't file, whatever, the different letters. The L plan. Most of them don't file an L and an M. They all file an N. So if they had a D, which most of them don't, they have to sell it to you at the same rate as a 65-year-old, which would be amazing. You know, it would be like $100 a month. That'd be a really good deal. Now, all the companies haven't sold D in years, and we know their strategy and that they will be bringing D out again. Now, they can just file it in Oklahoma and not file it in Texas, which is what will happen because of this new law. So it's unlikely you'll be able to get a Plan D. You could get a Plan G, which is what you really want, but in Texas, the state of Texas Department of Insurance said you can charge more for G, but you could only charge 200% more than you charge somebody turning 65. So for example, if somebody turning 65 could get a G in Texas, a female could probably get it around $100 a month. That means they could charge you, my 50-year-old person with end-stage renal disease, 200% more, which would be $300 a month. Can you afford $300 a month? You know, if you could, it would be a really good deal to be able to get it. Most people probably won't be able to afford it. The net effect of this new law in Texas, and will other states adopt this law, the net effect is everybody's insurance rates will go up. All Medicare supplement rates will go up because somebody that's going to have a transplant is going to be very, very, very expensive, and the insurance company has to float that price across all their other policyholders. So you won't see other states rushing to add this law. Like I said, New York's had it for years. Florida's had it since Alonzo Mourning played in the NBA, so what was that, like the 90s? Most states have not adopted this law. So for most people, if you get end-stage renal disease and you're under 65, you could get a Medicare Advantage plan upon getting Medicare Part B. And that's probably going to be a really good thing. It's better than only having government Medicare A and B. Now, you're eventually going to get a transplant, hopefully. After you've had your successful transplant, so if it's not successful, this doesn't apply. But after you've had a successful transplant, then you have a certain time before you're no longer on Medicare. After 36 months after your transplant, now you're no longer on Medicare. So if you were working, you can go back to your employer group health plan. If you can't work, then you're gonna look at your other options. Can you stay on your spouse's plan? Are you able to work, get your own job, get a new job? Are you unable to work, in which case you might have to go on Medicaid? Everybody's situation is going to be vastly different. So one last thing I want to mention is when going back when I was talking about after 30 months of being on ESRD Medicare, if you were working and you're on your employer group health plan, after 30 months, your employer group health plan becomes secondary. So they're not kicking you off the plan, they're just becoming secondary to Medicare, which means you have Medicare paying the majority of your bills, and ideally, they're paying all of it, but stuff they don't pay could be covered by your employer group health plan. Again, your employer group health plan cannot cancel you, they cannot terminate you, your employer cannot fire you because you're sick. They have to have a legitimate legal reason to fire you. And you know, when you're really sick and things are expensive, a lot of employers really show their true colors. So this is where employment lawyers come in handy. So I hope that this video helps those of you that might be dealing with kidney disease or have somebody in your family that might be dealing with kidney disease. Thanks for watching. If you like this video, you might really like this video. Check it out. And we'd appreciate if you subscribe to our channel so you never miss a great video. We put out one every week. Check in the description below this video for a link to our cheat sheet on Social Security and Medicare. And you can also give us a comment if you have a specific question. Always feel free to call us or email us at the Medicare Family.